Good morning, everyone. Sorry, we've got our first technical problem of the day. Thank you for joining. It's 7:30 in the morning in New Delhi, and I'm grateful to people in the United States, across the Indo-Pacific region, for joining today for our Indo-Pacific Business Forum panel on regional healthcare investments as the foundation for post-COVID economic growth. I'm Edgar Kagan. I'm the Deputy Chief of Mission for the U.S. Embassy in New Delhi, and I'll be the moderator for this panel. And I'd like to thank the U.S. Trade and Development Agency for hosting this forum, and also thank our experts. We have a really impressive array of people who are genuine experts in the field, unlike a lowly diplomat who really knows very little about this. And I really want to say that the format of the panel, I'm going to introduce each panelist, pose an introductory question, and then unfortunately, we're not going to be able to take audience questions, which is a little disappointing, but I think under the circumstances, I'm sure everyone will understand. Since the COVID-19 first emerged, the spread of the virus has turned into a global pandemic affecting countries across the Indo-Pacific region and around the world. This has been an event of a kind that I think none of us have ever experienced. Anyone who was around in 1918, unfortunately, probably is not participating in this panel. So, I think we're getting up to the point where we're transitioning from the sort of initial crisis to the sustained crisis phase. And, I think all of us are probably tired of the phrase, the new normal. But I think that it's very clear is that this is a seminal event for all of us, and that healthcare and healthcare investments have been absolutely critical for a global response, but are going to be very essential going forward. And that virtually every country in the world is having to really look very hard at its healthcare models and its healthcare systems in light of the evidence that we've seen over the past 8 to 10 months. I think what we've seen is that healthcare infrastructure is absolutely critical. And, for the U.S. government and U.S. government agencies like the Department of Health and Human Services, our Department of Commerce, Trade and Development Agency, Development Finance Corporation, U.S. Agency for International Development, and even the Department of State, we've all worked with our partners in the region to try and figure out how all of us can best address this truly unprecedented challenge, but at the same time looking at this as an opportunity to how do we improve the delivery and quality of healthcare for the longer term. The U.S. and India have a very long history of collaboration in healthcare, and it's truly been one of the success stories of the relationship, a relationship that has at times fluctuated a bit, but I think that across the entire period of over 70 plus years, we've worked very effectively on how to improve the quality of healthcare. And I think that what we've seen in the past 7 months is an extraordinary partnership between the United States and India that is built on this long legacy of working together. At the same time, I think that it's very clear that, like any partnership, it can be better. And so one of our challenges is how do we move from the phase of COVID response to looking at more sustainable, longer-term approaches that both build on the partnership that we have, but ensure effective and better delivery of all healthcare services. So I think that it's worth remembering that we've worked together with the government of India to figure out how to improve our ability to prevent, detect, and respond to epidemics, how to advance joint research and development, how to build on the extraordinary people-to-people ties between the United States and India, particularly in the area of research and particularly in the area of medicine and health. And I think that we've also looked at how we can broaden this out to think about how we can better restore and reorient global supply chains in ways that address the needs of the countries that are involved. And in order to do this, and if we really want to do this effectively, we have to think about how we mobilize financing, both for emergency preparedness and response, as well as for the longer term improvement of sustainable healthcare delivery. So building on that theme, we of healthcare as a key component of infrastructure, and I think we all know that infrastructure continues to be one of the primary challenges and great opportunities across the entire Indo-Pacific region. I'm joined here today by a panelist from the United States and India, with both government and private industry representation. And the panelists will give us diverse perspectives on different aspects of healthcare infrastructure, including, I think, what is perhaps the most important for us, how improvements and investments in healthcare infrastructure can help drive economic growth, as well as improvements in the quality and the delivery of healthcare. So what we're looking to do is to have a very quick introductory round with all the panelists, and then to try and go to a more general discussion. Our first panelist is Susan Capps, who will be speaking on health as an investment in economic growth. Susan is an executive director in global value and access at Amgen, and is also the chair of the U.S. Chamber's Global Initiative on Health and the Economy. At Amgen, she leads the corporate initiative addressing access to medicine. Susan, you get both the privilege and the slight dubious challenge of being the first to go. So I'm going to ask you the first question, which is, as chair of the U.S. Chamber's Global Initiative on Health and the Economy, you've been looking at how investing in healthcare is a fundamental requirement for strong national and global economies. Could you share with us some of your experience on how healthcare investment affects the broader economy, both in individual countries and across the regions? Thank you.
Yes, thank you. Happy to do so. And at the initiative, we work in several countries already around the world promoting health-centered policies to spur economic growth, reduce poverty, and create strong investment environments. So we're here to talk about health system ecosystems and infrastructure. And we know that health systems' primary function is to provide good, high-quality care to its people. But at the same time, a health system also plays an important role in the status and stability of national and regional economies. Too often, the economic benefits and the social impacts of health are poorly understood, and they are often overlooked in the mainstream development processes and investment decisions that are made at national levels. The debate tends to focus on the cost of health instead of health as an investment. By investing in health, we see the opportunity to grow the economy, advance development goals, and improve social well-being. In many countries around the world, the biggest contributor to ill health is chronic disease or non-communicable diseases, NCDs. By addressing these NCDs, not only are lives saved and the health of the society is improved, but it also contributes to a greater level of economic activity as more people are active in the workforce and they are contributing to society, whether they are volunteering in charities, caring for others, they're contributing. In September, the Global Initiative on Health and the Economy released a study. This report is called The Increasing Social and Economic Benefits Globally, Rates of Return on Health Investments. The study was done by Victoria University, and it found that countries would, on average, realize a return of $20 in economic and social benefit for every $1 invested in cardiovascular and diabetes interventions. When it came to anxiety disorders and depression, the return was $22 for every $1 spent. This study covered 27 countries, high income to developing countries. The data came from the World Health Organization's One Health tool in order to do the economic and social impact analyses. There were significant returns across all the countries. So for within cardiovascular and diabetes interventions, the study showed economic and social returns of $30 for both Indonesia and India, $23 in Malaysia, and $20 in the Philippines, just as some examples. The findings are particularly relevant for the COVID-19 situation, as we know the comorbidity of non-communicable diseases puts people at higher risk for mortality and serious complications from COVID-19. It has been so clear through this pandemic, the impact that health has on economy and the society. It has spotlighted truly the complex interdependencies between health and the global economy and has exposed just how fragile in nature the healthcare ecosystem can be and its inability to respond to both pandemic threats and the ongoing chronic illness crisis. So it's clear that we need to invest in resilient healthcare systems to address these future health threats. It's really time we change this dialogue from health as a cost center to a true investment in our economies and in our societies. Thank you, Edgar.
Thank you very much, Susan. And that's really interesting because, I mean, as you know, and as everyone here knows, that there's always been some controversy about how much to invest in non-communicables compared to communicable diseases. And I think that as we think about the question of, where do you get a return on investment, I think it leads us to a very natural transition to our second panelist, Andy Wentzy, who will be speaking on drawing entrepreneurs to the region. Andy joins us from Sanford Health, where he serves as Senior Director for the Sanford World Clinic. And as Senior Director, Andy leads the identification of opportunities for international partnership, which has resulted in the development of relationships and projects in 12 countries on 5 continents. Andy, Sanford Health is currently partnering with Victoria Healthcare in Vietnam on a series of clinics. And so, particularly in light of what we've just heard from Susan about the benefits to the society and to broader economic growth from investments, I think we'd love to hear from you to say, what are contributing factors that influence companies like yours when they make decisions on whether or not to invest in a new market? What are you looking at? What are you looking for? Thank you.
Yeah, thank you. I'm honored to participate with this great group and share a little bit about our work in Vietnam and some of the selection criteria that we go through. Sanford, if you don't know, is a large integrated not-for-profit system located here in the Dakotas of the United States. We've really focused the last decade of our international efforts on the implementation of sustainable healthcare services through various partnerships. And so they're all focused on really relationships. In Vietnam, we worked with Victoria Healthcare, as you indicated, since 2017, so one of our more recent relationships. But together, we've been developing a learning management system within its 4 multi-specialty clinics in Ho Chi Minh City or Saigon. But in terms of how we identify opportunities, vet markets, and apply investments, to say it most simply, we go where we're wanted. When you look more commonly at selection criteria or contributing factors on how an organization like ours might approach a market, obviously, there are some real simple categories. We look for political and economic stability. We look for a relatively positive record on human rights. And we look for the ability to, maybe more importantly than anything, the ability to recruit and train clinical staff. That's such a difficult challenge globally, really. So that's a key criteria. In terms of the characteristics for the partners that we look for, we do look for really decades-long relationships and potentiality. So we look for organizations that feel a lot like what we do, those that have the entrepreneurial spirit, that are high growth companies, that are really taking risks and trying to provide new or expanded services, particularly in rural markets around the world. But for private organizations, we look at those that are working alongside the government in a complementary fashion to create something new for the populations they serve. So I'm not necessarily looking to get into a competitive market, really looking for those that can be a supplement between the private and public sectors. In terms of the business opportunities, after quality care metrics, we measure success by growth and impact over time. So we want to impact the most people we can in these broad regions. But we are looking certainly for growth companies. These are not designed to be one and done relationships or pilots that may tread water for some time. We really want to work with those that are well positioned to grow across the country and in some cases even across the region through hub and spoke type models. We do seek mutual investment, and I think that's pretty common among organizations like ours that go into new markets. And certainly sustainability, as I'm sure you'll hear from most of the speakers today, sustainability factors and version of a pro forma or whatever forecast we can create is so important as we start to look at even initial investments. And then we also do look for opportunities for us to apply our very specific experience in creating systems and infrastructure, in creating networks and systems in these countries. We don't believe that a single clinic or a single pharmacy or a single research project is a solution or a positive contribution we really want to be some part of something bigger and broader for each of these countries. And last, we want to really focus on areas where we can try to be a lever for something new. If we can engage an organization that has a strategic plan with 4 or 5 items, and they just haven't been able to get to that 5th item, and that's something that aligns with what Sanford Health provides, that's something we would like to pursue together. And a lot of times, even politically, bringing in a third party allows an organization to be perceived differently by its government or competitors in a way that's more promising or less threatening maybe in those different markets. So to get back to Vietnam specifically, we saw an emerging middle class with a related sense of emerging consumerism in healthcare. We saw that the region had an appetite for alignment and growth further into even some of the more remote areas of the country. And we saw the beginnings of a regulatory environment and a consumer desire that really made this an attractive market for us to consider. And I think that's common among all of the markets that we've entered into globally. Last, I would say we've had a multi-decade relationship with one of the co-founders of Victoria Healthcare, Dr. Mason Cobb. And so we had a real credible connection with our partner there. And that's so important to us. It may take a decade for us to work through traditional mechanisms to identify a partner that we're comfortable with. But if we have someone that's familiar with our organization and is familiar with those in the country, that really sets us up for success. And we've certainly seen that even in these early years in our collaboration with Victoria. So just to summarize, the factors that really influence our ability or willingness to investment are drilled down to stability, relationships, and a pro forma that demonstrates to whatever extent we can that this is a sustainable venture into the future.
Thank you very much, Andy. That I think gives us a good feel for how entrepreneurs and investors are looking at emerging opportunities. I think that as we think about healthcare, and I know that Susan will grimace when I say this, but inevitably people think about cost. And one of the challenges, obviously, is how to balance the availability of services and the provision of services with the cost and the affordability. In doing that, I think one of the things that is increasingly important is thinking about procurement, because ultimately one of the major challenges for healthcare organizations at every level is how to make sure that they manage their procurement in a way that gives them what they need when they need it, but obviously in a way that manages their costs as effectively as possible. So our third panelist is a true expert in this, Trevor Gunn, will be speaking on better procurement to improve health services. Trevor is the Vice President for International Relations for Medtronic, the world's largest medical technology company. He is also the founder and chairman of the USA Healthcare Alliance and an adjunct professor for the Center for Eurasian, Russian, and East European Studies at Georgetown University. Trevor, it's great to have you on this panel, and I'd like to ask you, the USA Health Alliance has been reviewing and working with global partners that are looking closely at their healthcare procurement systems. Could you share with us how procurement, particularly healthcare procurement, impacts health services? And how can governments collaborate with businesses to ensure that patients get the right care at the right time all the time?
Well, thank you for that, Edgar, and appreciate the opportunity and the privilege to sit alongside my colleagues and for the invitation. I think let's talk about 3 different areas very briefly: principles, and then some mechanisms, and then maybe a particular programmatic area, if you don't mind. I mean, if you take a look at the world in which healthcare services, healthcare technologies today are procured, it's around price, volumes, it's around commodity purchasing. To give you an example from the company that where we work during the day, we are the creator of the pacemaker. And if you think about a pacemaker as something very similar to information technology, you would not just put one price on any type of PC. But yet governments around the world, literally, there are many different types of pacemakers for all different functions. They try to put the same price literally on every model, depending, and that has a high tendency, at least in medical technology, certainly in services as well, to commoditize that. I think what we see, and we see a lot of really encouraging signs, and these signs are as important in COVID-19 as they are even in peacetime, before COVID-19's outbreak, and hopefully after COVID-19's outbreak. And it's around value-based healthcare. I mean, don't ask me why, but healthcare is perhaps one of the sectors that's sort of escaped the value, the chase for value. Value-based healthcare is pretty simple. Michael Porter defines it as outcome over cost. Sounds easy, but it's really difficult to implement. And everyone's going to implement it in different ways in their different cultures. And it's as important in emerging economies as it is in emerged economies. But a natural outgrowth of that is around value-based procurement, where you're putting in life cycle costing, where you're talking about the total cost of ownership. You're putting in factors like the cost of society. And Susan, I'm sure you would agree with a lot of that. You got to look at a lot of these things very, very holistically. Now, value-based procurement is really tough to go through, and it does take time. It takes commitment, really, within the government. It takes very definite procurement commitment within the private sector. So let's quickly talk about some mechanisms, and I'm really happy to report that, in the U.S. government, HHS, in fact, Deputy Secretary Hargan, that Colin works very, very closely with, we've talked very, very many hours about value-based healthcare and how to implement that in the U.S. system. In the EU, you have something called competitive dialogue, which means that the private and the public sector, you try to focus on what is to be procured. What is it a service? Where do we focus the value? And I think that the competitive dialogue is a very, very healthy process. The World Bank has, in the past 3 years, actually implemented, I would argue, the largest procurement reform in the post-war period. And the medical technology sector, I'm proud to say, was actually the second the programmatic area in which they focused. And they do focus on those exact same principles that the private and the public sector need to really get in a safe room together to talk about what's actually needed. And then you go to formal procurement mechanisms. And I'm happy to say also Asian Development Bank, that of course is active throughout the whole Indo-Pacific region, also has adopted many of those training principles, as well as some of the other development banks. We hope that many of the countries will also move in that direction. And then finally, maybe just to highlight one very, very specific thing is private-public partnerships. And you can think about private-public partnerships almost as anything that you would want to do. I would like to talk about private-public partnerships the way I would maybe talk to my grandmother, which is that I'm doing something exceptional for the government if the government would do something exceptional in return. It's not normal purchasing. We're both in risk together. We're both making sacrifices. Is there a possible way that we can actually advance both interests together? It's very, very important, but it's very difficult when it comes to healthcare. And Edgar, you've mentioned it, and you're talking about healthcare as infrastructure is the war cry of USAHA. It's why I founded USAHA, because the fact of the matter is, and I think COVID-19 has really brought this highlight. Dams, power, road, traditional forms of hard infrastructure, healthcare should be in that pack. There's no reason, and they should all be learning from each other. And this is, but where we see actually healthcare PPPs right now focused are actually in a couple areas that sort of strike the match halfway. And they're very good areas, but it's not enough. For example, in renal dialysis or imaging PPPs. These are great. And Vijay, I'm sure you'll talk about the Indian experience here, because there are many of those type of PPPs in India. And India is a leader in the world in private-public partnerships, thinking and breathing private-public partnerships. But we think that it can go beyond. We think you have to procure for outcomes. We think that you can go to entire populations and promise a government a particular outcome on, say, in diabetes, in cardiovascular care, and others. You have to complete the circle in our particular view and go into the areas of therapy. So I hope that was a contribution to the dialogue. Thank you.
Thank you very much, Trevor. That was very helpful, and I think that, again, it's very, very useful for all of us to think about the different perspectives that different panelists bring And I think we've heard three very different perspectives, but what is striking is the degree to which they overlap and the complementarity of them. In that same spirit, our fourth panelist brings a different perspective, and one that I, as a government official, probably a little bit more familiar and comfortable with. And that's from obviously the government. And so our fourth panelist is Colin Mciff, the Deputy Director for Global Affairs within the Office of the Secretary for the U.S. Department of Health and Human Services. Colin will be speaking about leveraging global collaborations and U.S. expertise. The Department of Health and Human Services is obviously dedicated to promoting and enhancing the health and well-being of the American people. It's the largest department of the federal government and has over 80,000 employees across 26 divisions. And we in India benefit from extraordinary collaboration with the Department of Health and Human Services, led by our health attaché, who's actually with me in this room and making sure I don't screw anything up too badly, and Dr. Preeta Rajaraman. And I think that one of the things that we've seen is how the longer term work of the department and of different government entities over the years has really made a tremendous difference in establishing the foundations for cooperation. And we're very grateful in Admission India for the commitment and the partnership with the department. So Colin, I'd like to ask you to share what your perspective is on the global health initiatives and collaborations that HHS is working on. And in particular, what U.S. technology and expertise do you see at the forefront of the healthcare sector?
Sure. Thank you very much, Edgar. And really, let me say at the outset, it is just a privilege and an honor for me to be able to join you all today and to be a part of this conversation. I know Deputy Secretary Hargan had very much wanted to be here, not only for the topics that we're discussing, which are very, as Trevor mentioned, very dear to his heart and that he spends a lot of his personal time on, but also with the partners that are represented by the Indo-Pacific Business Forum across the region. This is really just a critical area of innovation and dynamism, where I think a lot of the solutions for this COVID challenge are going to come that are going to benefit really the whole world. So thank you for having me today. For the United States perspective, what I can say is that to combat the COVID pandemic, we are collaborating across really all stakeholders through a whole of society approach. And this reflects the fact that this is a disease that, as others have said, affects every single one of us in one way or another, and one that can only be fought with the full engagement of communities, state and local authorities, federal support, academia, industry, and the contributions of the private individual. And I really do hope we have a chance to come back on the PPP conversation that Trevor started as well. I think that's just an absolutely essential part of the solution as well. One manifestation of that in the US that folks are probably tracking is the Operation Warp Speed effort to bring a vaccine to market as quickly as possible. And we're really proud of that whole of America approach, as we say, and what that's achieving right now. As folks may know, we have 4 vaccine candidates in phase 3 clinical trials. Just sticking with the vaccine theme for a moment, as folks may know, vaccine manufacture requires production of components in addition to what we think of as the immune response stimulating portion of the vaccine. So depending on the type of vaccine, it may require, for example, adjuvants to boost the immune response, liquid media for their delivery, and syringes for a delivery mechanism. We are proud to have boosted our domestic manufacturing capabilities and capacity, which will help us meet the domestic needs as this moves along. And as I think, and as our leaders have said multiple times, once our domestic needs for vaccine are met, we very much want these products to be available fairly and equitably after consultation with the international community, with stakeholders. And what I can say on that, we haven't had the decision at this time to join the Global Act Accelerator Initiative, which folks may be aware of. But we are in very close technical cooperation with them, with all of the leads of the Act Accelerator, whether that's Gavi, CEPI, the vaccine R&D, PPP, or or WHO, and we anticipate that collaboration continuing as we move forward together. In addition, the HHS global workforce is in more than 60 countries with more than 600 direct hires and more than 1,400 locally employed staff. We believe and hope that this presence is and the collaboration that it entails is a mutually beneficial relationship for all of our partners. Through this global action and the placement of these staff, we certainly protect the health and promote the health of all of our citizens through the region, and leverage our expertise and relationships in support of shared health goals. And ultimately, this, we believe, contributes to a healthier and safer world. You'll find no government that is more committed than the United States to strengthening immunization programs around the world. It's safe to say that the U.S. government is involved in supporting the national immunization programs of most every country in the region, that's listening in and participating today. And we believe that that's just a critical foundation for health. We offer technical support from staff at the Centers for Disease Control and Prevention, based both in the U.S. and in countries around the world, as well as the efforts of U.S. government employees embedded in WHO and UNICEF, offices at global, regional, and country levels. And we provide technical and financial support for laboratory testing of vaccine preventable diseases, and laboratories at the CDC in Atlanta serve as global specialized laboratories for polio and measles. Just a couple of words on Operation Warp Speed. A couple more thoughts on that. This is leading. This concept is helping to coordinate our National Institutes of Health and its accelerating COVID therapeutic interventions and vaccines partnership, active partnership, and the rapid acceleration of diagnostics of the RADx initiative. And on October 9th, we announced an agreement with AstraZeneca for the development and manufacture of their monoclonal antibody product, which is a similar product to the Regeneron monoclonal antibody that folks may have seen in the news was used to treat President Trump recently during his recent illness. In our efforts to promote medical countermeasures, countries in the Indo-Pacific region have been and will continue to be key partners. These vaccines and therapeutics are tools to help us get through the pandemic, but it is truly time, in our view, to look forward and think about what initiatives, collaborations, and expertise we're developing each separately and together that will be our foundation for a post-COVID world. And one example on that, just to spend a couple of minutes in terms of that, if you can say there's a positive lessons that we can already point to that have been learned through this COVID experience, it's really been in the rapid acceleration of telehealth and digital health. I've heard Deputy Secretary Hargan talk about this as advancing our own national response at least 5 years from where it would be if there hadn't been the pandemic, just out of necessity. And so it's something that we've learned a lot and would love to again share and build on experiences we have together. So, for example, we've been able in our country to largely resist disruption to ongoing medical service through this very rapid transition to telehealth services. And the advance of the digital economy and digital technology tools, as well as increased flexibility and financing, has optimized the remote provision of care where indicated, preserving healthcare capacity for in-person visits where needed. We at HHS have also revolutionized the utilization of data inside the government for decision making through the aggregation of COVID-19 related data through one accessible but secure hub. And this has allowed rapid data sharing to foster innovation, the development of insight, and the testing of new and exciting models through data sets that cover the entire United States, including the entire cabinet level federal government, U.S. territories, and through collaboration with partners of HHS's Indian Health Service and our Center for Medicare and Medicaid's Medicare and Medicaid program, which also includes some of our most vulnerable populations and rural and hard to reach populations. Again, a challenge I think that really cuts across economic development levels and everything that really we all face, and many countries in the region really face those same challenges. And we think that that same connectivity can also then be harnessed, of course, to support long-term regional economic growth, improve supply chain efficiency, and supporting resilience in the face of future disasters and public health emergencies. As referenced at the East Asia Summit Health Experts meeting on COVID-19, the U.S. is working now to link the U.S. electronic customs document system with the ASEAN single window, a project the U.S. government has supported over many years. We believe that this will allow trade, transport, and commercial data to be exchanged electronically among government agencies and the private sector. This COVID crisis has been so disruptive that we need to find these these opportunities for learning and to really jump on them together. And so again, this is a really great opportunity to have this discussion together. And with that, I'll stop there. But thank you very much for the opportunity.
Thank you very much, Colin. And I'd like to get to our fifth and final panelist, and someone who the U.S. Embassy in India has found to be a truly extraordinary partner. Someone who combines, genuine scientific expertise with, if I dare say, quite exceptional bureaucratic effectiveness. Dr. VijayRaghavan is the principal scientific advisor to the government of India. And he will be speaking about India's investments in science, technology, and innovation to amplify the effectiveness of its health sector. As principal scientific advisor, Dr. VijayRaghavan is responsible for ensuring a coordinated approach amongst different ministries as they implement their respective science and technology programs. This includes biodiversity, health, artificial intelligence, quantum computing, and waste to wealth, amongst many others. And I just want to say, how grateful I am that Dr. VijayRaghavan has agreed to join the panel. And I think that as we think about Indo-Pacific issues, and which is obviously the heart of the Indo-Pacific Business Forum, I think that it's really very valuable to have a strong participation from India, both because of its growing economic importance, but also because of the extraordinary innovation with which India is trying to address healthcare challenges. Dr. VijayRaghavan, I would like to ask you, could you share how India's investments in science, technology, innovation amplify the effectiveness of your health sector?
Thank you very much, Ambassador Kagan. I'd also like to start by saying how fruitful, but how important also our collaborations between our two countries have been over the years in this sector. The US-India Vaccine Action Program is one strong example. We have taken successfully through that program a major vaccine recently, the rotavirus vaccine, into our immunization program. But there are many other flagship programs which have taken place under that umbrella, including research on tuberculosis, other vaccine preventable diseases, and our collaborations in other areas such as non-communicable diseases have also taken place very strongly. So that's something very good, and that must be kept in the background. The other component which we must keep in mind is the extraordinary relationship in the non-government sector, people to people, as it were, between Indian scientists, clinicians, medical doctors, surgeons who have gone back and forth. They have contributed enormously to the U.S. health system, and their understanding, their value in that system has fed back to learnings in the growth of the Indian non-governmental medical space enormously. I know our hospital system at the high end is extraordinary in no small measure because of this collaboration. And thirdly, a collaboration in industry, whether it is the pharma industry or the drug industry, similarly has benefited greatly from talent from India being embedded there. So there's a great interaction, but I would like to highlight that one important feature of this interaction it's not utilitarian. It's based on shared values, and it's based on principles about functioning, which we naturally share in two large democratic countries. So these need to be kept in mind as we go forward in our collaborations. Now let's come to key aspect about how science and technology can impact on the health system. Now, for science and technology to have impact on the population as diverse as India, each of our states is different. And we have, as I like to say, a France and a Germany on one hand over here, and some of the most challenging aspects also over here. We are a salt and pepper mix. And so therefore, when we talk about healthcare systems here, we should not look at one size fits all in any way. Health is a subject in which the federal government comes in with solutions. And so that adds another layer of complexity. In that situation, we saw a dramatic change in the nature of science and technology interactions post-COVID or during COVID. And we will see that going ahead post-COVID. Before COVID hit us, our drugs and pharma industry were extraordinarily well known for their generics and for vaccine production on scale. 2 out of 3 vaccines in the global immunization program of organizations such as UNICEF, which every child gets, are made in India. But they're made in India, again, we must remember, through extraordinary collaborations with the NIH in terms of fundamentals of vaccine discovery and development, and through global partnerships. But what the pandemic showed us is that both in vaccines and in other areas, in medical products, Indian industry was not only valuable in bulk, but it's got into vaccine development in a way which it did not do so on scale before. So India is also making vaccines as distinct from only manufacturing, stockpiling, and distributing vaccines. So that's an important change. Another big change is the extraordinary bridging of the gap between our science and technology institutions, our top institutions, and our industry and our society. I used to bemoan that our top science and technology industry institutions were a short walk from India, that they had such extraordinary capability, but they need to be connected in an outcome-driven manner to bringing solutions. The response to that globally from such institutions is invest in us and it'll pay off in some manner in the long term. Now, this is true, but this is not something which governments easily see. Governments work on a shorter cycle and like to see returns, whereas institutions are built on much longer cycles. But the pandemic has shown us how these two can come together. Our astronomers, our mathematicians, our computer scientists, our biologists, our clinician researchers have come together in such speed to provide solutions in a manner which has been seen only sadly in big wars, where everyone comes together to have certain kinds of solutions. And this has been extraordinarily valuable in every sector. I'll give you 3 examples. In terms of personal protective equipment, India used to import everything. Now India is an exporter. And this includes, by the way, aspects such as manufacturing ventilators, oxygen support devices, and so on. The second I've already mentioned is about our vaccine development and how that has grown enormously. But related to that is testing and tracking. Indian diagnostic kits for testing, there have been several which have come up. And the important point here is, as we've heard before, a merger of quality and frugal innovation. So we have really good high-end testing kits coming out, which are about the 10th of the cost of what corresponding or similar US kits or European kits would be. But importantly, these are now taken over in partnership by big industry in India, who will partner with US industry to distribute these at low cost, high quality across the region here and also across the world. So this testing is really very important. The third point I'd like to end with that is the digital aspect. India has a contact tracing app, the Arogya Setu, which has now 150 million users. It has also got a voice response system for those who don't have smartphones, and it uses information from manual contact tracing and telephone tower information to feed back into the local health systems about the likelihood of spread over the following week or 2 weeks. And this is intensely used now so that we can curb spread in a dynamic manner. Now, this needs to be scaled up in a manner which is now a phenomenal opportunity, which is the use of telemedicine, both for health delivery to the last mile, which requires human training in an extraordinary manner. And that scaling up the human component is very, very important. But the internet, again, is being used to have many components of that training in place so that, many aspects which are required, which require high infrastructure, can be at least approximated by telephone, by video training, so that the health system is up to speed. The pandemic has highlighted a very important feature of the large public health system and the reach needed at the last mile. The assumption that public health is only about, importantly, very importantly, about nutrition, health, lifestyle, and so on. That's, of course, critical. But high-end services should be accessible only at centers and cities, as posed a dilemma in social equity. The availability of equipment and facilities and modest training in multiple areas is feasible. Combined with video conferencing systems, the excess of interpretation is going to become phenomenal. So you're going to see now partnership within India and abroad, where really top quality scientists and clinicians are going to be able to work with data in real time and participate in consultation sessions for public health anywhere in the world. And this is going to be a big game changer, in addition to having frugal, high quality equipment, sensors, devices linked to the Internet of Things, also participating with the US and India in collaborations. Thank you very much.
Thank you very much, Dr. VijayRaghavan. And, unfortunately, as always seems to happen when you have such extraordinary panelists, we are, of course, running out of time. And, as much as I would have liked to have had a round of questions for everyone, I'm afraid we probably won't be able to do it within the time that we have. But I'd like to thank all of you for the insightful discussion and for the, very, very interesting and I think impressive in how different the perspectives are, but how similar the underlying themes are, which is, number one, this is an extraordinary challenge. It's also an extraordinary opportunity. I think what we've seen is that from a private sector perspective, from a kind of sectoral lens, from a government perspective, all of us are trying to balance how we take advantage of the disruption and the opportunity in order to leverage our existing capabilities and also advance what we have discovered and what we've managed to develop during this extraordinarily trying period. I think we all recognize that healthcare is going to be even more important going forward, and that it's also linked to health security, but it's also about, as we've heard from the panel, about healthcare as infrastructure and as something that, if we get this right, if we build off what we've learned, if we build off the challenges of this crisis, it gives us a lot of momentum going forward to both build out, but also to come up with greater innovation, to come up with new approaches. And so I'd just like to very quickly summarize that we've heard from Susan about healthcare as an investment, including in non-communicable diseases, something that historically many governments have been somewhat reluctant to invest too much in prevention, and particularly in international cooperation, and that this is something that pays tremendous returns. And I think that's a very valuable perspective for us as we think about what kind of systems we want to have going forward. We've heard from Andy about what it takes to bring entrepreneurs into the game. And in particular, I think it's really extraordinary to hear the similarity between what he said from an entrepreneur's perspective about the importance of partnership, also the importance of stability and thinking about the longer term. That this is, his comment that, they're not coming in for a very quick one-off relationship. They're looking for sustainable long-term partnerships and looking for this as a way of developing rather than just getting an immediate return. I think that Trevor's comments about the importance of value and the importance of thinking about value as you invest in healthcare is something that historically governments haven't necessarily been good at. I think is particularly valuable when we link it to what we've heard from Andy and Susan. And then, I think Colin has done an extraordinary job giving us a sense of the whole of government perspective from the U.S. side, and also the importance of the pre-existing relationships and collaborations. That these things help accelerate the partnerships and the ability to really get innovation. And try and address both an immediate crisis, but think about it from a longer term perspective. And that ties in very much with what Dr. VijayRaghavan was saying about the importance of both the pre-existing relationships, but also that even within a country, and I think we often forget this, a one-size-fits-all approach doesn't necessarily work. And that it's important to leverage the skills that we have and that have been used, as he said, in ways that normally are only done in war, that to try and also think about it and how they can be applied in a way that makes sense for those who are receiving the services. And so I think across all this, what we see is an extraordinary amount of creativity, genuine advancement in terms of capabilities in the Indo-Pacific region. And I think, opportunities for businesses and investors as well as for governments. So with that, I would just like to thank all of you for participating. I'd like to thank our audience in Hanoi and elsewhere who are listening in, and to say that, this has been extraordinarily valuable for me. I've learned a tremendous amount. I hope you have too. And that, this is where the opportunities are going to be in the coming years. So with that, thank you very much.